Claire, I would ask you if you have something on your mind right now, what would be important to you to say?
I am very sorry for this, all these technical problems of the screening. Okay. We have sometimes technical issues. I don't know. My aim was really to show a sort of story of our lives on the side of what is not told usually is the problems that women, cis or trans, face all along their lives. And this was my idea from the beginning. And also the idea that I wouldn't follow any case, but just film at these different points the patients who were okay for me to film. And so we were a feminine crew of, there was a girl, a young sound engineer, and a young assistant. And we would, I had explained to all the people of the hospital, of this unit in the hospital, what was my idea and how I would do the film with no interviews and really trying to see what was going on between the patients and the doctors and the birthplace and I never know the word in English, the in vitro lab and everything, and surgery and so the doctors, they were absolutely okay, because my idea was that it was very interesting that they had chosen to put all the gynecological problems in one only unit. So that, yeah, and then we talked with the patients, and sometimes one of them said yes. And also the doctors, they were very helpful also. They would ask for us. And that's how the film was made, yeah. And then by the 2/3 of the shooting, I knew I was sick. And then I decided, because I wanted this consultation of announcement, that all the doctors told me, no, you can't film that because we can't go in the waiting room saying there is a little crew of documentary and then telling the patient how bad or good it was for this person. And then when it occurred to me, it was obvious that I was interested by filming that, because I was, yeah. So that's how I decided to do it, even though I was not sure I wanted to be cured in that hospital. And then I changed my mind, because when I filmed after I knew I was sick, I realized that I had some doctors that I really liked, like this woman surgeon that I really liked very much, and I thought she was really wonderful. And I thought it was easier because I knew them. And at the same, just after, there was this doctor which was sued because of obstetrical violence. And so there was this demonstration. And I thought I should film it because it was a part that I hadn't seen. These traumatic consultations which were told by an actress. She was reading all the testimonies of the patients, and I thought then I can have a sort of it's a way to know how it is when it is very bad, and yeah, and then I edited it after this meeting of all the doctors, so to speak, to show that it was not a perfect world, even though it looks quite perfect in a way. I mean, the public hospital in France is not having enough money, but it is an incredible thing. I mean, it is scientifically very, very good, and the fact that everyone is treated the same way, whether you're rich or poor, black or white, Chinese or it doesn't matter. And this is a very beautiful thing that we have. And when I was shooting, I remember each day I would go in the hospital, I was thinking, this is an incredible world, because each time I come in, I know that everyone has the same right, which is not true when you're outside. So I thought it was, because in France there are films saying that the hospital it has a lot of problems and everything. And I thought that, on the other hand, you have to show that it is very precious. And even though this film is not about the hospital, but about the women patients. So I think I have said what is usually asked to me, so you can ask me other questions now.
Yes, thank you very much. You answered a lot of my questions, but I would give space to you, to audience. Does anyone have a question? Some feeling, something you would like to share?
Yeah.
Yeah?
Pokud nevadí, tak já budu mluvit česky, pardon, moje angličtina není na takové úrovni. Můžete to třeba simultánně přeložit? Děkuju. Já moc děkuju za nádherný dokument, i když minutáž mě trošku zaskočila, ale jsem ráda, že jsem to tady zvládla. A mě vlastně zajímají dvě věci. I když váš dokument nebyl zaměřený na to, jak nefunguje komunikace třeba těch zdravotníků, jestli vy sama jste se setkala s nějakou takovou nepřiměřenou péčí?
I will try. You can check if I'm right. Even though the film was not focused on the communication between the patients and the doctors, if you had some
v roli pacientky, jestli jste se setkala
and
s tím.
if you became a patient, if you had some kind of bad experience in yourself.
Yes, I did. And I changed the doctor. Yes, I wanted to be looked after as an oncologist by a woman, and she was very unnice to me, and so after a while I changed the doctor. She was very rude, very unnice. Yeah. So it happens. But as a patient, it's very important to have your own point of view, your own strengths, to ask the questions, to have the answers. The first oncologist, was the head of the unit of oncology, and I remember he never answered my questions, never. He said, you'll see, and I was furious. So now I have a very good doctor. He is a man, but he is very nice.
A ještě teda druhý dotaz, jak dlouho jste byla pacientkou, jestli nám můžete prozradit?
How long have you been a patient for?
Well, it happened to me. I had surgery in November 21, and so I still go and see the doctor once in a while. But I'm okay. I'm fine. Yeah. Thank you. Yes.
I'm sorry, there was maybe the first question, sorry.
So my question is, like you didn't follow the stories of the patients, but I guess when you were there filming, you met them maybe more times than you filmed them. And how does it feel to not know what happened to them? Or like, yeah, how is it to not follow the stories, but just to be there at that one moment? Because for me, as a to see that was like difficult to know that I will never know what happened to them.
Yeah, well, I had some answers, but I feel that if you, yeah, well, it's a different point of view. I was sure not to be taken by one story, because then it is how is the patient, how is the doctor, what are, you know, it's for me it's anecdote more than knowing all the cases. You can see the faces, the strengths of anxiety and everything, and then it's another story. Yes, it is something that we face very often in documentary. The choice you have between following a story or trying to make a sort of portrait, and this was more an abstract portrait of the life of women. If I would have followed any case, I wouldn't have been able to show this sort of story that was more abstract of the life of women, and it's always very different. Of course, you can take one case. I remember there was in France a famous film of Depardieu about justice, and it was, you could see each person coming and the person of the justice in front, and of course we wanted to know more. But it was very strong to see all these cases. It made another story. But with one character, he followed her, and he made another film about one character, one person. It's always, but I think that it's like in writing a script, or it is, I feel, maybe because I am influenced by modern filmmakers, but I think it is really interesting to have a sort of territory of the film, which is not only led by a character, by a story of a character. It's always problems of narrative problems. People think that in documentaries there is no narrative, but it's only narrative problems we have. You wanted to ask something?
Just a second for the mic, please.
Maybe it's not needed, but I had actually completely the same question. If you are curious about the destiny of the patients, but you already answered, so thank you very much for that. And maybe I have a question, if you feel a bit maybe stronger after your own treatment, or maybe weaker or confused? What are your feelings after your treatment?
Well, it's not really the problem of my treatment, but of the film. The film helped me a lot to face my illness, because I had seen I had filmed other persons, other people of all age, and also other women who had been through cancer. And when I knew that I was sick, I knew already what had happened to a lot of women I had filmed. And I had filmed several, so I knew when it was at the beginning of the treatment, when it was in the middle, when it was in the end, and what was the protocol. So I was curiously so optimistic at the beginning, because I knew, that's what I'm telling the doctor when he tells me that I need surgery and everything, is I was very optimistic all the time. Then I was not that optimistic afterwards, but I think, well, the film, I think, for people who like it, is important because you see other women, you see a lot of cases, and then you know that you're not the only one, that it's not malediction, that you're with very strong, very good doctors, that they don't decide, it's not one doctor who decides, but the whole team of the doctors who are deciding and discussing your case, which means that there is no problem of diagnosis with one doctor. It's the whole team, which is really important, I think, and very comfortable, yeah, much more comfortable. And so, yes, well, I don't think very much about it for my own case. Well, of course, I have to face it, and I am always very anxious when I saw the last doctor last week, because she changed, she's not in Paris anymore. And she said, how are you? I hope it's going to be okay. So each time it makes me really frightened when the doctors are saying that. But then I forget.
Is there a question?
Okay.
So
we
maybe
have to go.
Yeah, I have millions of questions. I just want to give a space to the audience. Okay, I wanted to ask, as you described your very clear focus and very clear vision how the film is gonna be, and it's about the journey of the collective body, I would say. Did you have maybe on the really very beginning some other films on your mind? Because exactly, you could make a film about the system, you could be focused more on the doctors. Was there something you were, you had more ideas than this one?
No.
Okay, and why did you choose this perspective?
This was my idea. I don't know what to say.
Yeah, and when you like step in front of the camera, you become part of the film. It goes with the tradition of feminist cinema, feminist way. Would you describe or would you consider yourself as a feminist filmmaker?
Yes.
And okay. And
I think everyone is leaving. We should stop.
Do you think so? I think here is a lot of people who are interested.
Okay.
Are you? But
Yeah, okay.
do you have something to ask?
I am a feminist filmmaker since the first film I did.
And when did you realize you are? How was the inner journey to you when you really considered?
Always. I've always been a feminist filmmaker since I was 18.
So there was some moment when you realized.
Yeah, well, you don't understand why life is going to be so more difficult for you, that you shouldn't be making films because you're a woman, that all these things, of course, they are there because you want to have equality. It's obvious, for me, anyway. Yeah, I've always thought like this.
Yeah. Maybe come back to the film, because this would be also very interesting to talk about. Okay, maybe there is one, yeah.
Thank you for such a very strong documentary, and I'm just thinking that it can be used for training of doctors in Czech Republic, because such an empathic approach, we really need to have it in our faculties. So would you think about it, to use it as a training tool for medic or nurses? So it's just idea, because it was fantastic how they approach to the patient. So thank you for that, to showing that it can happen, and
Yeah.
for me it's really fantastic to see it.
Thank you very much. Yes, I think films are done to be seen and used if they are useful. And but for example, there is one thing that I don't agree with in the point of view of the doctors in the film. I don't agree completely, is the fact that for them, mainly, they are obsessed with preservation of fertility. And not all women want to have children. And they must know more about that, because it's always the same ideology that is coming back. They want, of course, it's wonderful to know that if you have a very bad surgery and everything, that you can, if you have endometriosis, that you can still have children and everything. It's wonderful. But it's not your only aim in life as a woman. And of course, in men's mind, it comes back like a horse, running. And they always go back to that. And they don't think, as Simone de Beauvoir would have said, that we're all individuals and that women have this body, which means the reproduction of the spicy, and then it brings a lot of problems and a lot of states in steps in life, and but it doesn't mean that all women want to have children, and maybe they want, maybe a lot of women want, and I was really pleased to have a daughter, and I'm really very happy about it, but this is not the only life of women. And this is not very clear in the mind of some men, even the doctors, because they fight for, of course, the fact that they want the body to be cured and to be strong enough and to do what is possible. But there is one scene when the doctor explained to the girl who has endometriosis that she should do the preservation of fertility, and she says, no, well, I'm afraid because I'm learning a new job and I'm passionate about it, and I don't want to suffer that much that I couldn't go to the school to learn my new job. And he says, this is life, you see, life is more important than work. But if you reverse the situation, he is the girl who has endometriosis, he will never quit his job as a surgeon, right? So this is not, so I don't agree with everything that the doctor have said in the film, of course, and that's why I show it. And I think if this film is used, it must be analyzed also in these kind of things.
There is a question.
Děkuji za velmi silný dokument. Já, když jsem se několikrát ocitla v nemocnici, ať sama nebo se svými dětmi, tak jsem si pokaždý říkala, tady by měl stát někdo s kamerou, tohle by se mělo nějakým způsobem zdokumentovat, co se tady odehrává. A někdy jsem prostě prožívala to, co i v tom filmu bylo vyjádřené, vlastně tu bezmoc toho pacienta a tu moc toho lékaře. A
Stop.
Yeah.
She can't translate.
She thanks for the documentary, and the lady described her experience when she was in the hospital with her children. She felt like in the documentary somehow, and also she felt sometimes she is not in the power, or how to say in English, bezmocný, without powerless, totally powerless. Yeah.
A vždycky mě napadalo, že vlastně tohle by mělo být nějaké jako téma veřejné diskuze. A chtěla jsem se zeptat, jestli jaká vlastně veřejná diskuze nastala po vašem filmu, jestli už jste se s něčím setkala.
And that her position as a patient or the relevant should be somehow thematized, should be a topic in the society when she felt powerless, which the institution made her feel powerless. So she wanted to ask if your documentary opened discussion on this topic, on the relationship between the doctors and the patients, and this hierarchical, sorry for my pronunciation, relationship.
Well, I don't know, yeah, but that's why there is a demonstration at and of course there is this, but the doctors I have filmed, and the midwife and the nurses, they are very much aware of that, and they try to be very cautious about it, and they try to give back the power of understanding and trying to make decisions for the patients. I remember in some meeting of the doctors, some doctors would say, but this patient, she doesn't want radiotherapy, and you can't make her do radiotherapy. So she went back to cancer and again, but they couldn't force the patient to go to radiotherapy, you see? So it's, they know that people have their own will.
Yeah, it's good, and it's not like everywhere. I wanted to ask, we will need to finish now?
Yes.
Okay, now. But one more question, please. Did the hospital or the management of the hospital and the doctors had a chance to see the film? Maybe.
Yes.
Did the film mirrored something important to them?
Yes, they liked the film very much. Yes.
Okay. Thank you very much.